Hey, Rob, how are you doing today?
Caroline, I'm living the dream. I can't complain. How about you?
The same. So, I was thinking today, Rob, about our guest, and I know that we have been focusing a lot on the whole person, physical, mental, financial, but there's something that goes a little bit beyond all of this. And this is just looking at individuals and their needs. So, tell me what you hope to get out of today's podcast episode.
I think it's going to be really enlightening when you talk about not just in general about the equalities just in the workforce that are so critical, but also, around equalities within a benefit program. And our guest today is going to talk about health equity and specifically around drug benefit programs. And as companies know, the drug benefit programs typically the most expensive part of your benefits program. So we have a great guest on today. Her name's Tara Liu. Tara is the AVP of Drug Strategy, Product and Workplace Strategy, Workplace Benefits and Retirement at Canada Life. That's a big title. So she's got a big job. And I think our group is really going to enjoy listening to her today talk about creating DEI and drug benefit programs and processes that insurance companies, specifically hers at Canada Life, go through in some situations that typically I'll say that most advisors and employers might not even consider or even know is happening. So it's going to be very enlightening for people to be aware. And then as you and I kind of banter back and forth, is talk about what type of communication and how critical it is for employers to make sure to share this type of information or what they can share with their staff specifically.
Yeah, absolutely. I think any employer that's going to listen to this episode, I think that we're going to really find out how they can truly stand out and make a difference as an employer, especially considering Canada is such a diverse country. The employee working population is so diverse today and even more so in the future. So let's bring in Tara and see what we can learn. Welcome in Tara Liu from Canada Life. Tara, tell us a little bit about your background and the role that you play at Canada Life.
Great. Thanks for having me. So, I am Assistant Vice President of Drug Strategy at Canada Life. I am a licensed pharmacist and been working here for about 14 years. I lead the teams that develop prior authorization criteria, work on drug reviews, negotiate product listing agreements, basically touch anything revolving drug benefit plans at Canada Life.
Great. And we know for what we do as benefit advisors for our clients, we know that the majority of claims costs that go through a benefits program are through a drug plan and are growing and growing at a high rate. So, to our thousands of listeners today, Tara, what would you want our audience to get out of today's podcast?
Yeah, I think we want to talk more like about DEI and benefits, right? And it goes beyond just about hiring or resource groups. I really want people to think about how it should be considered in every part of the benefit program. And Rob, as you mentioned, the drug is the most utilized benefit. We got to think about how we can consider embedding these things into those core benefits, such as the drugs.
That's great. And so, it's an area of concern for a lot of companies, as I mentioned, is costs are on the rise. We've seen the rise of specialty drugs in the marketplace. We've seen the rise of, um, you know, drugs like Ozempic, which kind of came on the map and exploded for so many benefit plans out of nowhere. But when it comes to talking about DEI, give us a couple examples what you mean by DEI in your drug benefit design.
Sure. So DEI, I think what we need to really focus on is true definitions of health equity versus equality, right? And that one is equality means giving everybody that same thing, right? Equity means giving people what they need to succeed, which might be different for each person, right? So in health, that means you recognize that there's barriers and tailoring support to overcome them. So when we talk about health equity and DEI for the benefit plans, health equity is really about fairness, right? It's about creating those policies that help everyone have similar health outcomes, especially for people who might face more challenges, right? Just giving everyone the same thing or equal for all doesn't always work because it ignores the different needs and barriers people face.
And Tara, it comes to mind that, back in the day, we go back 40, 50 plus years, plan designs, healthcare benefits were designed with a certain amount of coverage, and this is what is covered for everyone. And what you've just said there, I know Rob and I spent quite a bit of time with a number of guests in past episodes. And, one example that comes to mind is learning about even pharmacogenetics, what drug will work for a certain person based on their DNA and their needs. But even beyond DNA, it can get a little bit more complex in today's population. Canada's population is evolving rapidly. And how do you think that impacts benefit planning?
Yeah, great question. Our Canada's workforce, right? It's increasingly diverse, right? We were thinking there's projections about by 2041, half of that population, right, will be first or second generation Canadians. But we also have the increased rate of chronic disease. Right now, about 44% of Canadian adults live at least with one chronic condition. And that's a significant burden on our healthcare system and a challenge for employers trying to maintain that healthy and productive workplace. So while Canada is statistically, we're one of the healthiest countries, not everyone has the same access to care or health technologies. And that's where that DEI, or diversity, equity, and inclusion, really comes in. So when you embed those DEI principles into your benefit plans, employers can better support the unique needs of their workforce. We're seeing kind of two major trends in this space, right? First, that focus on employment equity, right? Rethinking hiring practices and pay structures and leadership models to reflect that more diverse talent pool that we have here. The second one is that those expanded product offerings in private insurance, like gender affirmation benefits or family building supports, which recognize, that families and identities look different for everyone. But ultimately, when the benefit plan reflects the realities of that diverse population, they become more effective, more compassionate, and more sustainable.
So when you talk about health equity, which is a concept that is definitely new to a lot of people in the benefit space, but not new just in general as a the hiring practice in general. So how would you define the difference between, like, say, equity and equality? Because I think that's something that benefit plans are looking to do. As a lot of employers understand, they got five generations in a workforce, and everybody
Yeah,
has different needs at different times. But I can't give everything to everybody. But I want to
yeah,
be fair. So
yeah.
maybe can you define for that what that would mean from your in Canada perspective?
Yeah, for sure. So, going back to those definitions, equality is giving everybody the same thing. So, from a benefit plan, that means everyone has access to the same thing. Everyone must meet the same criteria. There's no flexibility whatsoever. Equity, when we're talking about health equity and, that fairness and maybe giving something a little bit different for somebody else, means that you have maybe policies at a payer level, either public or private, to account for those people who might have those different challenges or different aspects, in their life that would make them benefit for something that's a little bit different. And I can go through some examples. There's some different situations that we can talk about. First one being, I would say, when you're talking about specific claim assessments, from a payer perspective, sometimes when we're dealing with prior auth medications, when people are applying for these high cost specialty medications, we sometimes require that people try certain types of drugs first, right? Sort of step therapy, right? To make sure that they've tried the lower, more cost effective medications. Sometimes there's situations in certain populations where they cannot take those certain step therapy medications. So understanding that. An example would be Jehovah's Witnesses. They may refuse blood transfusions or even blood derived therapeutics, or those products. And that's sometimes a challenge when some drug plans or through prior authorization require a trial of a blood product before approving a newer medication. So understanding that we might need to consider an exception for that type of situation. Another example, in Jewish law, they forbid oral use of medications containing glycerol, stearates, lactose, or porcine products. So you might get requests saying, I can't take this one because of these situation. Will you consider on an exceptional basis? So there's several types of examples of those. Like, I could go on and on about those where we need to be able to consider and understand that these types of situations may come up so that we can evaluate it. One time back in my pharmacy practice, I had a patient, a Muslim patient, and it was during Ramadan. And one of the rules of in Ramadan is fasting, right? And we had a patient who had started on a medication a few months earlier and is one that needed to be taken with food, right? To help with absorption, reduce stomach upset, all those
Yeah.
fun things, right? But the patient couldn't take it that way during Ramadan. Right? So we had to go and get an alternative covered for them so that they could, you know, be able to take that medication and have that benefit of it while respecting Ramadan for them.
So, Tara, I have two things going through my mind. Number one is, what does that process look like? I think from a plan member perspective, they would need to feel comfortable to come forward and disclose to the payer to say, this is
Mhm.
my situation. And so, what does that process look like, number one, for you and your team? And then I have a
Yep.
follow up question.
Yeah, for sure. I mean, it depends on the medication that they're using. Some of them don't aren't on prior authorization. So a lot of these types of situations you just see sort of on that maintenance drug spend. So doesn't need a request or anything. On the prior authorization medications, sometimes that information is volunteered right there on the request for the medication, right? Either in a section from their prescriber or from them themselves. Sometimes they'll attach a letter or a little blurb on the form for us to consider that when we're making our assessment.
So it's great to have that process in place. And, I'm thinking again back 20, 30 years where typically someone that is looking at a certain medication may, check online or look in the booklet and say that's not covered. So it comes now to the point of maybe my follow up question to Rob. What type of communication can you think of that your clients, your plan sponsors, employers, how do you create an environment where it's known that, hey, we want to look at the whole person, everyone's different in your needs? So to build that environment where it's just known that you need to own your health situation and communicate that.
Well, I think that's it. And those are great points. And, typically if, our office, if we got 100 phone calls, they would say that, well, you know, the carrier didn't cover this. And why was this not covered at the dentist? And why is this, the pharmacy didn't cover this based on my plan design? And around the education importance of looking at if carriers like Canada Life are willing to look at scenarios outside the traditional 9 box of just black, white, here's what should be paid, and we're only going to pay this, to know that it's an evolving situation. So, first and foremost, I always think that there's greater communication required today than ever before when it comes to managing your corporate benefit program. That's so key. And it's consistent communication because the workforce is always evolving. People come, people go. So people it might not be important at that time, but I start a specialty medication 2 years from now. What's the process, as just an example? So, you know, so valid, Caroline. And Tara, coming back, talk to us then about what are some of the training that you take your team through to, whether it's educate physicians, specialists, or pharmacists, because he and she, they're all very busy people to start with. And so what's the education that might be involved in these situations where you're willing to look at situations, but more so the information you need to make that proper adjudication?
Yeah, great question. We have obviously my pharmacist team here on staff, but we also have physicians and our nurses as well. And what we do is make sure that they have this awareness of all these different situations out there, right? Like understanding, that Ramadan type of example, to understanding that sometimes it dose escalation requests for maybe somebody who is obese and medications aren't necessarily studied always in an obese population, and we need sometimes a higher dose in there to make sure that the drug actually gets to where it needs to be so it actually can have the effects. We make sure that all our healthcare professionals and our people who are assessing these claims are aware and know where to bring these types of claims to the experts so that we can make that clinical interpretation on that case by case basis sometimes, right? Again, depending on the plan, that there's make sure that there's actual valid clinically as well as supported from the health equity perspective.
And would you say like these situations for you to review them are they more common now than they were, say, a couple of years ago or 5 years ago, because of like this how the a lot of the new drugs have come to market, or what percentage of claims
I
would
would say
fall into
it's
this
still
category?
very, I would still say it's still very rare. I think there's just more awareness of it, right?
Hmm.
And more of an acceptance like, hey, this is a little bit more valid. Whereas in the past, it's like, no, it was more of that equality, right? Not the equity. So I think with that lens, I don't say there's likely not as lot more than there has been. It's just more awareness that these things could happen and come up and what to do when they do come up.
Mhm.
Oh, that's great.
Tara, can you share also, like, so far, a couple of those examples I think, relate to someone's personal belief system. Are
Yeah.
there other types of equity examples that you can share, maybe even things that are happening in the public system, additional examples that will help us further understand the opportunity out there to help individuals?
Oh, for sure. Yeah. On the public side, contraceptives is the key one that comes to mind, right? So you think about British Columbia, Manitoba, PEI now offer free prescription contraception, right? It's about reproductive health. Like, why are they doing it? It's the gender equality and reducing costs from unintended pregnancies, right? And why did those provinces do it? It's to, remove that barrier to access, right? It's that sort of quote unquote female tax. It's giving those females the economic empowerment that they can make a decision about their career or education or finances, and that barrier to access, that cost to access, is not there. It's reduced for them, but it also reduces healthcare costs too, right, associated with those unintended pregnancies. Giving birth is the number one most common reason for hospitalization in Canada. So if we have estimates of 40 to 60% of pregnancies in Canada are unintended, it also makes good economic sense for the public plans to start covering those as well, right? To get those offsets.
And particularly for those that don't have any coverage, right? So the fact that the
Correct.
public can step in for those that don't have coverage, amazing.
And
Um,
Exactly.
cost should never be a barrier to any of these concerns. Absolutely right. So, is there, Tara, a specific a category that you see more situations where you're looking to make exceptions over others? Is it around, like, whether it's like you mentioned obesity, or is it like pregnancy or ethnicity? Is there
I would
anything in
say age,
particular?
big one. So what happens?
Really?
Yeah, age. Because Health Canada, when they approve a medication, it is typically for an adult, so 18 and older, right? But what about somebody who's 16 or 17 years old who is physiologically similar to an adult, right? We need to assess those cases fairly, even if the drug is labeled for, right, 18 and above. So prescribing and doing claims assessment for patients less than 18, it becomes categorized as off-label or not approved by Health Canada. But it's appropriate to consider those types of situations, right? If there's no physiological factor that would make a difference between a 16 and an 18-year-old. Talking about a 12 or a 6-year-old is much different, but when you're getting closer to there, again, that goes where health equity comes in.
Sure. So it's just kind of now, is it the claim still coming in from the doctor, or is it, and then, like, making
Usually
sure
through
that you're making
special,
that
yeah,
assessment?
prior authorization requesting that. But there are some out there and some plans that only follow Health Canada, right? So if Health Canada says it's adults, that's defined as 18 and older. Again, if somebody's 17 and a half, 17, 16, they're all the
I got
same.
s- I got 17-year-old boys that show up at my house to say hi to my daughter, and they're all like 6'2" with size 14 feet, and I'm going like,
Exactly.
so I'm not even
Physically.
close to either of those. So, it's a good point, right?
Yeah,
So it's a
yeah,
good point.
exactly, exactly. I mean, that's the most common one. I think some that come up from time to time, you mentioned like pregnancy. Again, pregnant women, they're not included in clinical trials for ethical reasons, right? So the evidence to determine if a drug will work in that population is often pretty limited. But because this population excluded, sometimes payers have to think about different levels of evidence, right? Usually we want the most robust evidence to say, yes, yes, we're confident that this is going to work in this situation. But in situations such as pregnancy, we have to sort of lower that threshold to make sure that we can give that equitable access to medication.
And do you follow up with patients after when you've made exceptions, or is that hard to do as an insurer versus just maybe Just what you could probably tell if someone stops a drug versus continue it. Is that
Correct. Yeah,
probably
you
the,
can see it in the
okay.
claims data if they're using it or not. Their follow-up would be more with their healthcare team directly, right? Their prescriber and their pharmacist who's dispensing it.
Okay.
Yeah.
Tara, I'm thinking about, we always talk about modernizing health plans, looking at innovation and access, building plans that are, affordable yet, looking at that whole person. So I start to think about some of those innovative drugs and how they're consumed. Some are pill format, some are injectables, others. Can you comment on any situations related to that where there's multiple ways to ingest a medication, but maybe how might DEI come into play here?
Yeah. Yeah, absolutely. With those ones, we often talk about more convenience, right? Everyone wants a more convenient form to take of a medication, whether it's just once a week or it's a pill versus injection, that type of thing. When you're talking from a health equity perspective, think of an injection that somebody has to self-inject themselves. They have to administer to it. If they have a physical disability or have some issues with dexterity, what if they are unable to do that, right? That doesn't allow for appropriate and safe administration. They have no one around to help them. But if we have an oral medication that is maybe a little bit more expensive, shouldn't that be considered for that type of population, right? Because if they're not able, again, that barrier to them is how the drug is administered. So, can we have a different format available, even if it is a little more expensive, for a subset of that population that would be they're able to achieve that same health outcome, right, with a different medication. Those are things that you need to think about, like when a payer is reviewing a new medication, right? There's sometimes those accessibility issues, right? Not only for physically being able to do it, but even mobility, right? Like there's some medications that people have to go and get lab monitoring, right? They have to go get blood tests all the time to make sure that things are working. Well, people who have mobility issues, they can't necessarily go out all the time. And maybe there's other medications, again, that are available that don't require all that home monitoring, right? So should we consider those for those individuals that have challenges with mobility?
Great. Talk to me about now when I put on my benefit advisor hat, what type of reporting could maybe companies get to know that maybe, or is it even possible from your side that could provide the reporting side, Tara, that could say we made exceptions for, obviously not, it doesn't have to get into the person's name or drug or anything like that, but we made exceptions here for these situations and why. So, because obviously as an employer, I would never know who's claiming what through a program, but I'd love to know if these were exceptions where my team would know. I'm like, hey, they've been really happy because my carrier, my Canada Life went, made exceptions for me that I didn't know, that either A, I didn't realize, or B, I didn't think would happen.
Yeah, I mean, a lot of these things are probably happening without you knowing it through the
Sure.
drug program, right? That maintenance spend that aren't through prior authorization. I think I'd have to take that one away, Rob, to see what type of reporting would be available for that one. At the end of the day, everything is still has to be within a reasonable allowance to approve, right? If it is going to be approved, and some of these are done on that case by case basis for that specific
Yeah,
plan.
absolutely, absolutely. Yeah, just curious, dude, because that would be great to relay
Yeah,
that to companies to know
yeah,
that's a reason, things that you're doing that's really proactive that most people aren't aware of, that either A is happening or B
yeah,
everybody's doing, right? So that's
yeah,
critical too.
yeah.
Cool, like it.
So Rob, I'm sitting here thinking again with your advisor hat on, all about communication and education, and I'm going to go so old school when I say this, but I think one thing an employer might consider doing to try to promote awareness about flexibility and wanting to meet your needs is the good old survey, employee population survey. Is that, I'm trying to think, how could an employer get at this other than asking, does the benefit plan meet your personal needs, without getting too much information that's personal back, right? So I'm just trying to figure out ideas, but what's going through your mind as to how you might, or even Tara, to share
Yeah. When I
what
could
you've
see
heard.
the wheels turning there, first and foremost, I knew you're going to ask a question. I thought you were going to pull out a flip phone or something when you said you're going old school. But when it comes to, I think that's great. And, I know a lot of BA partners, including us, we do a lot of staff surveys and, like, how do you like the plan? And does it meet your needs? I think those are critical more than ever before. And, I'll say this is the best part about it is if an organization is looking to do a revamp, it's really critical to know, like, hey, what's a pulse? What is does this meet my team's needs? Because we know benefit plans have gotten expensive for employers over the years, and just because there's other costs have gone up with all the different services, and people's needs are growing as well. But really have a pulse of understanding, like, does it meet your needs? I think is critical. The only advice I give back, if you're going to do a survey, make sure you act on it as an employer, right? It is because people will be looking for a response and feedback. But I can tell you just from our records, in comments that we get back, people will usually say, "Thanks for asking me." So I
Yeah.
do. I think that's if that's a great takeaway, knowing that, maybe somebody would. We've had situations where people said, I had a situation with the carrier. They got involved directly in my situation. I was really happy with the outcome. It was nice that I had a personal connection and personal touch in a situation. So I don't know, Terry, you might find that too, because I'm sure your team would physically have to interact at times with
Yeah.
patients sometimes, right? Provide
Yeah.
clarity around your doctor prescribed A, but we moved you to B, and these are the reasons why. Is that probably fair to assess?
Yeah, yeah. There's times where we have to make those phone calls to help them understand why something was covered or wasn't covered, that type of call. But to your point, Rob, like I think it's really important for employers and sponsors to know their workforce, right? Like who was your plan originally built for?
Bingo.
And maybe it's who you're trying to support moving forward, right? Because your workforce has changed potentially. So understanding the future workforce, right? Their educational background, their culture, language, religion, gender identity, age, family status, sexual orientation, right? Like that helps you not just for those optional benefits and product offerings that we talked about, like family building and gender affirmation, but also helps you again for those core benefits, right? To understand what could potentially come in and what you need to support them.
And you're totally right. And your benefits have to mirror your corporate culture and what your
Yep.
philosophy as an employer to start with. And they have to be aligned because it's such a great form of compensation for staff more than ever, and it's a very important form of their compensation. So you're bang on, Tara.
Yeah. So as we think about our listeners today, I'm all about action. Let's say, are there any other key items that people could listen to this podcast and walk away and take action? What would you advise them to do as employers?
Yeah, I would like, it would be great if sponsors were able to start thinking about all parts of their benefit program, right? And is DEI considered in every part of it, right? Not just those new offerings, but like in your core thing. Are the payers you're working with and partners you have throughout this process, are they going to be able to support your members in these types of situations?
Well, this has been great. I've learned a lot today, Tara and Caroline. It was really engaging, and most of all, to understand the process that Canada Life goes through behind the scenes, and and really trying to make the plan, especially the drug benefits program, more equitable for everybody. So we really appreciate your time, and thanks for joining us today.
Thank you. Thanks for having me.
This has been the Benefits Alliance Voice. If you enjoyed this episode, please share it with your network and be sure to check out the podcast notes for any additional materials.